Okay, welcome everyone. So today's training is going to be about Medicare and Social Security basics. Every week we have a weekly webinar where we show you everything you need to know to become successful in the health and life insurance business. Today specifically we'll be talking about Medicare and Social Security basics. So a couple of things, as you can see in the screen, what is Medicare? People don't know what is Medicare. A lot of people also confuse Medicare with Medicaid. There are actually two different programs, so it's important that you know the difference between the two of them. So Medicare is federal health insurance. Medicaid is state health insurance for low income. So we're gonna talk about Medicare. Medicare is federal health insurance. People get a red, blue, and white card when they're eligible for Medicare. Medicare is designed for people over 65 that have a legal status in the US. Usually a permanent residents or US citizens are the ones that are eligible for the Medicare program. People that have a work permit are not eligible for the Medicare program. So only people that are permanent residents and US citizens are the ones that are eligible for the program. People with Social Security disability may be eligible for Medicare without having to wait till 65 to join Medicare. The reason for this is that when somebody applies for Social Security disability, they have a 2 years waiting period for Medicare. So let's say they apply for Social Security disability at 50, when they're 50 years old, they get approved. Once they get approved, they have a 2 year waiting period before they give them Medicare. The reason for that is because they want to make sure that they're actually eligible for, they're actually disabled and that they're actually eligible for health insurance and that they're not going to go back to work. So people that get approved for Social Security disability are also eligible for Medicare after 2 years, after a 24-month waiting period. The requirement for free Medicare is 40 work credits. That's equal to about 10 years of work. And by work, I mean work where you put into the system, not under the table. It's work where you actually contribute and they take Medicare taxes and Social Security taxes from your paycheck. So usually 10 years of work will equal, or you will have enough credits to get Medicare once you retire or once you turn 65 or once you get Social Security disability if you become disabled. People over 65 can also buy in their Medicare insurance if they never work or don't have enough credit. So how does that happen? So people that, let's say, never work in the US, but they are either a permanent resident or a US citizen, they have the option to buy Medicare insurance. So usually Part A, which people that work and put into the system, they get it for free, but Part A does have a cost, and it's about $422 a month for Part A. And as you know, Part B also has a premium, which is $144.60 now in 2020. So people have the option to buy into their Medicare coverage if first they can pay the money and if they have the legal status. If they're over 65 and they have the legal status, they can buy into the Medicare program. Now, Medicare has four parts. Part A, which is hospital, Part B, which is the medical, C, which is the Advantage plans, Medicare Advantage plans, and D, which are the drug coverage. And we're gonna dive into detail on each one of those. Part A is the hospital coverage. So a couple of things you need to know about Part A. And it's important that you, when you're meeting with a prospect and you're comparing the Medicare program or the original Medicare program versus the Medicare Advantage, which was what we offer to them, it's very important that you know and are able to compare A and B versus the Advantage. So Part A, this is what they get when they get that red, blue, and white card. So they get Part A. Part A is free for most people. They get it automatically once they turn 65. Now, Part A has a deductible. A lot of people don't know that they have to pay a deductible if they're hospitalized, and Part A will cover hospital expenses, right? The deductible is $1,364, and that only covers 60 days of the stay. So if somebody has to be admitted for more than 60 days, they'll have to pay more money out of pocket, which I'm not going to go into details on that, but it's not free. They do have this deductible that they're responsible for, even if they were only in the hospital for one day. They have to come up with over $1,300 deductible. The other problem with Part A is that it only covers the hospital board and room. So technically, everything else that they do at the hospital is covered under B. And if you don't have B, you're gonna be charged a lot of money for that hospital stay, even though you had A. So everything the doctor put on you, if they did x-rays, if they did blood work, everything else they do at the hospital while you're there is covered under B. The A will only cover the board and the room. That's important for you to know because a lot of people just have A and they don't have B, and they think they're gonna go to the hospital and they're gonna pay, and that Medicare Part A is gonna cover the whole stay. No, they will have deductibles, plus they will also have to pay for everything they do at the hospital except the board and the room. Medicare Part B is the medical. Part B is not free like Part A. Part B has a premium. Monthly premium for 2020 is $144.60. Everybody gets a letter every year on how much they have to pay for Part B. Part B also has an annual deductible. This amount keeps raising every year. And for 2020, that deductible is $198. What is a deductible? As insurance agents, you know that the deductible is an amount that you have to pay before Medicare Part B covers services. And they will not cover any services until you meet that annual deductible. It's $198, almost $200 before they can get any service covered. After you meet that deductible, then it's an 80-20 situation. So Medicare will cover 80% of all your medical services, and you will still have a 20% co-insurance for all your medical related services. What's included in B? B is like your insurance, everything as far as doctor's visits, specialists, x-rays, blood work, surgeries, inpatient hospitalization, outpatient hospitalization, all of those things are covered under Part B. And you will have a 20% co-insurance, which could be a lot of money if you don't have anything else to go with your Medicare. So still you'll be liable for a lot of expenses if you only have A and B. That's why we recommend people to get on Medicare Advantage or to try a Medicare plan. We actually let them know that they need to have something else to supplement all these extra expenses that they have with only Medicare A and B. For people that waive their Part B, a lot of people don't want to pay that $144.60, and they cancel the B. They said, no, I don't want nothing to be taken from my check, and they make the bad decision of canceling B. So there is an enrollment period for those people that want to get the B again. Every year they have the option to apply for B between January the 1st and March 31st. Social Security calls that the Medicare General Enrollment Period. Every year from January the 1st to March 31st, anybody that doesn't have B can apply for B, but it has to be during that time frame. The only exception to that, if they are losing any employer group coverage at the time of eligibility, or if they waive the B because they were still working, then they have to fill, in addition to the Part B application, they have to fill out an employer application form where that they have to submit saying that they had coverage also, in addition to the that they have coverage, and that's why they waived the Part B. So just a couple of things there about Part B. Part C, Medicare Advantage, this is what we do. This is where we get most of our commissions as insurance agents. So Part C are offered by private companies. What are the qualifications to get Medicare Part C or join a Medicare plan or a Medicare Advantage plan? First, you need to have A and B to be eligible. You need to have both. You cannot have one or the other. You need to have both. If you don't have both, you will not be eligible to join a Medicare Advantage plan. The only disqualifying condition that they'll look at is ESRD, which stands for end-stage renal disease. Pretty much what that means is dialysis. If somebody goes 3 times a week for dialysis, pretty much they were diagnosed with end-stage renal disease. So anybody that has kidney failure and that is receiving dialysis, they will probably have end-stage renal disease. That will be a disqualifying condition, and they will not be able to join a Medicare Advantage plan unless they have a Medicaid plan and they can be grandfathered into the Medicare part of that plan, if applicable. And we'll go over that at the end. Now, like I said, it's offered through private insurance companies. They are offered in HMO or PPO type of plans, usually like an employer plan where you pay a copay and you have a network. Most of them will help with Medicare insurance deductibles, Part B premium reimbursements, prescription coverage is included at no extra cost in most cases, and they give you a lot of ancillary benefits that are not available with original Medicare. So a couple of things, and you use this to compare Medicare Advantage versus original Medicare. So first, they'll pick up your insurance deductible. How much was the deductible for A? How much was the deductible for B? They'll pick up all that deductible. You have no deductibles with a Medicare Advantage plan in most cases. Some of them will even contribute towards the Part B premium. So a lot of people are interested in saving money on the Part B premium, the 144. Some of them will give a reimbursement towards that. Prescription drug coverage is included. Part D is included. Usually people that want Part D, they have to pay extra for it. Medicare Advantage plans already offer that at no extra cost to them. Ancillary benefits are included in most plans. Things like dental, vision, hearing, transportation, over-the-counter medications, acupuncture, chiropractor. All these extras are included, which are not covered under original Medicare. So it's a very nice benefit package that we can offer them. And of course, we can compare all these benefits versus what they get with original Medicare to make them understand that this is a no-brainer. All this, like I said, is for a zero extra premium on most plans. And then we got the Medicare Part D. So Part D is the drugs, prescription drugs, or the pharmacy coverage. Most Medicare Advantage plans already include the D. Now, if the prospect or if the person is not interested in Part C, they need to buy a standalone prescription drug plan, otherwise they'll get penalized. The price for prescription drug plans ranges depending on what they want the plan to cover. It could be range from $30 minimum to $100 a month, depending on what they need to be covered and the deductible they want to have and all that. And this is also offered to private insurance. Once you sign up for Medicare A and B, they don't give you D, they don't give you the drugs. So you have to buy that separately, and you have a time frame to get Part D, otherwise you get penalized. We'll go over that shortly. The other option Medicare members get when they are eligible is the Medigap, also called Medicare Supplement. The Medicare Supplement was the way to go back in the 90s and the early 2000s, but now we're seeing that a lot of new Medicare retirees, they are going the Advantage ways because of all the savings they get. Medigap is a Medicare supplement, so it's like having a secondary insurance to offset their Medicare cost. So pretty much they will keep, if they go with this option, they will keep their original Medicare, which is their A and B, and they will have a supplemental plan to offset that 20% that they have to pay with original Medicare. So it's offered to a private insurance also, like most carriers have Medigap policies, or most of the big ones have Medigap policies. Some plans will also help with Part A and B deductibles. Now, the price range is usually very high on this plan. So Medicare Advantage plans are zero cost. Medicare supplement plans, they will have to pay an extra premium between $100 to $300 depending on coverage. Sometimes if they're older, it might be over $300 for a Medicare supplement plan. So on a yearly basis, they might be paying $3,000 to $4,000 a year for healthcare coverage, where they can save all that with an Advantage plan. So that's the difference. They can either go with the Advantage plan, have an all-in-one package, or go the old way with original Medicare and a supplemental plan. The only reason why most people will go with a supplement versus an Advantage plan is the freedom. With the Medicare supplement, you have original Medicare as your primary insurance. You have no network. Most doctors work with original Medicare. If you travel a lot, they have the freedom of using their Medicare anywhere in the US. You don't have a network. So people that usually have that type of situation, that they travel a lot and they want the freedom, they will go with the Medigap. And of course, they need to have the money to pay for it every month. Now, we've been able to convert Medigap members to Medicare Advantage by offering them a PPO option, because PPOs will also save them on the monthly premium and will give them access to out-of-network services at a lower cost share. So you can still convert somebody that has a supplemental plan to an Advantage plan. Most likely, if they like to travel, you will have to offer them maybe a PPO option. This is just a chart about the different Medigap options they are. They have different plans, and they run from Plan A to Plan N. Again, this is Medigap. This is not Medicare parts. This is something totally different. And then it tells you what each of these cover. And I'm not going to go over this in detail, but as you can see, Plan F was the best one. It covered actually 100% for everything. That used to be the most popular Medigap plan or Medicare supplement plan. Now, as of 2020, this plan is no longer available for purchase. Whoever has it can keep it. But as of 2020, nobody else can get it. So the next option will be the G, which is the one that will cover the most as far as Medicare supplement plans. So these are the most popular right now, G's, but there's like C also is really good. And again, if you have a client that all they want is a Medigap, we can offer it through some of the carriers. However, we rather get them on Medicare Advantage plan because it's all zero for them. They get the whole deal. They get all the extras and they don't have to pay any more monthly premium. Late enrollment penalty. So we'll go over this real quick. Part B is 10% of the monthly premium per year without Part B coverage. So somebody that didn't have Part B, and then later on, 5 years later, they decide that they want Part B, they're gonna get hit with a penalty of 10% per year without coverage. Part D also has a late enrollment penalty of 1% per month of the national average of the Part D plan premiums. So they have to sign up for Part D within 62 days after getting their A or their B, otherwise they'll be hit with the penalty as well. This could add up quickly if the person doesn't get Part D within this time frame. So really important, whoever is new to Medicare, they need to get D, either through an Advantage plan or either through a standalone Part D plan. Otherwise, when they join one plan, they're gonna get penalized. Of course, all the penalties are waived if the person qualifies for some extra help, like state programs like Medicaid, Medicare Savings Programs or MSP, or the low-income subsidy through Social Security. So if somebody's paying a penalty right now and their income is not a lot, you can help them get approved for these plans or these assistance programs, and they'll waive all the penalties. This is just a quick example. So somebody that's 70 years, didn't get their Part B at 65 when they were supposed to get it, but now they need Part B. Now they have some conditions that they want to see a doctor and they want the Part B because they want to join an Advantage plan. I have these cases happen at least once or twice a year. Of course, they're going to be hit with a penalty. So they had 5 years. They're 70 now. They were eligible for Part B at 65. So it's a total of 5 years without Part B, 10% per year, 50% of premium. So they're going to be hit with a penalty of 50% of the premium. So the premium, how much is it? 144.60. They're going to multiply that times the penalty, which is 50%. The penalty is 72.30. So what they do is that on top of the regular premium, which is 144.60, now they have to pay this penalty every month for lifetime. Remember that every month for lifetime, they gotta pay that penalty. It's not a one-time penalty, it's actually every month. So they're gonna be hit with a penalty, and now their new Part B premium is gonna be $216.90. So that's how you calculate the Part B penalty. If you have a case like that and you're not sure, you can also let us know and we'll calculate it for you and help you out. But it's pretty much straightforward if you do the math. Now, the Part D enrollment penalty is 1% per month without coverage. So, of course, in a year, we're talking about 12%. 1% per month in a year is 12 months, 12%. When you multiply that, in this case, 5 years without coverage, we're talking about a 60% penalty on the D. Now, the national average of the Part D premium, I'm just gonna say is 40. It could be 45, it could be a little less, but that's about the national average right now for a Part D plan. And of course, what they're gonna do is that they're gonna calculate the 40 times the penalty, which is in this case is 60%, and then that's about $24 a month. So you put them in an Advantage plan, and instead of being zero premium, they get a bill from the insurance company for $24. So make sure if you have a situation like that, before you leave the house, let them know that they might get hit with a late enrollment penalty for not having coverage when they were eligible for it. And these are just some examples. Again, this might get waived if you help them apply for assistance coverage. We're gonna talk a little bit about Social Security. Social Security is a federal program that helps older Americans who worked and became disabled or retired. This is how the system works here in the US. They can retire as early as 62 with a reduced benefit, but will still not get Medicare until they're 65. So really important, a lot of people choose early retirement. They will not get Medicare at 62. They'll still have to wait till 65. So if they're your customer, most likely you have to put them on an ACA individual plan and then do the transition at 65 once they get Medicare. Now, of course, if they've been disabled for over 2 years, they get Medicare right away after the 2-year waiting period. They don't have to wait till 65. Now, a lot of people don't know this. If the person did not put enough work credits, but they're married to their spouse, they may use their partner's benefit or they may use their partner's credits if the partner is already retired or over 62, if they've been married for more than 10 years. So if you speak to somebody that maybe didn't have their work credits, but they were married to somebody for more than 10 years that did apply to the system, hey, that person is entitled to use the spouse benefit to apply for Social Security and Medicare. Same rules applies if a couple was married for more than 10 years and then were divorced. So if you're no longer with that partner, but still you were married for more than 10 years, you bring that marriage certificate to the Social Security office and you can apply for their benefit, and they'll give you, they will not take from his check or her check, but it's called spouse benefit. They'll give you a portion of his entitlement, and they will not take anything from his. You just get some of what he worked. It's called spousal benefit. So that's something good to know if you have a case like that. This is just the time frame of the full retirement age nowadays. So right now we're looking for people that are that were born in 1955, right? These are the people turning 65. So these are the people we're looking for right now that are eligible for Medicare. And of course, the full retirement age has changed. It's not 65 anymore. It's now 66 in a couple of months. And for anybody that was born in 1960 or later, it's going to be 67. So full retirement age is changing. And of course, they will always prorate you. So if you don't want to wait till 66 or depending on when you were born, they'll still give you a prorated amount of your Social Security check. And I think this is the last step here. If a person is a US citizen, this is also really important, and over 65, but never worked in the US or never have or did not have enough credits, they may be eligible for something called SSI, which is Supplemental Security Income. This is not the same as Social Security SSA or Social Security Retirement. This is actually a supplemental assistance if they meet the low income and asset criteria. So very limited resources in order to qualify for this. But if somebody's not getting a check because they didn't have enough credits, you can let them know about the SSI program. And they have to be a US citizen to be eligible, and they have to be over 65 years of age to be eligible, or be disabled to be eligible for the SSI program. If they're eligible for SSI, they'll automatically get Medicaid, and most likely state Medicaid will pay for their Medicare premiums. So even though they didn't work, state of Florida or state Medicaid will pay for their Medicare insurance if they're 65. So they get Medicare anyway, even though they didn't put anything into the system. So same as scenario above qualifies for the state to pay for the Medicare premiums. Like I said, if they have SSI and they're 65, usually Medicaid will pay for the Medicare premiums, and you can put them on a dual eligible special needs plan after they get Medicare and Medicaid. We have a lot of people in that situation, and they don't get Medicare automatically. They actually got to call Social Security, let them know that they're on Medicaid, and then they'll put them into the Medicare program if they're over 65. All right, that's pretty much it. Any questions? We got about 2 minutes, and then I'll jump into the Spanish training. Any questions about what we covered so far?
No.
All right, cool.
No, I'm good. Thank you.
All right. Thank you guys for showing.